Now we're going to get in here and treat the hip capsule. Once you've cleaned up the adductor, now the hip capsule is very important. Now, the key is actually the position of the client. You want to have them stacked up just like this, and you actually want them to scoot towards the bottom of your table on the very edge. So come down just a little bit more, and they'll be set up just like that. And what you're going to do is take this back leg and let that go here, and the leg is going to rest right up against the table. Now the motion here is the client is going to start by keeping their leg on the table, and they're going to slowly bring that up through here, and you can even have them reach down with their other leg behind the hamstring and finish off the rest of that motion, because we're going to get what's called hip flexion to open up in there. So what we're going to do is have the client move up like that, and then when it gets close and they can't go any further, they're going to reach under with their hand and pull their leg up to finish off the rest of that motion, because we want to get full flexion in here. This is the test that we're fixing. Now, watch the palpation video in how to get on the hip capsule. If you don't get on it, you can't treat it. Now, the key here is actually your body mechanics and how you approach it. So anytime you're treating the capsule or the lower part of the hip, you want to approach it at about a 45-degree angle to get that to open up. You've gone through the palpation to find that. So you found the greater trochanter, you found the backside of the trochanter, you sink in just like that. And that's right where that hip capsule lies, and you found it. I've already taken the client through the motion so they know what the motion is and they know how to do that. Always check with them to make sure they have it right. Now the key here is going to be your body and how you set up. So what I like to do first is I just have my thumb nice and relaxed in here. And come over a little closer. I have my thumb nice and relaxed in here, and then I'm going to back it up with this other thumb. And essentially what we're going to do is we're going to get some depth in here, and then we're going to get some tension on that as well. So to start, you're going to line up right over top of it, and I get a nice wide stance here. That allows everything to relax. And what I want to do is have my arms nice and straight, and I'm going to lean in with my body. That lean in is where you're going to get your depth. And for the capsule, you want to get more depth. So you're going to push with this arm just like that, and then your tension is going to be a counterclockwise kind of lean like that. You're going to hold that, and the client's going to start to do that motion. Go ahead. And it'll pull right away. And you're going to stay right over top of it, just like that, and they're going to open that up. So like we said, the key is getting your body over top, and I'm very strong in here. I'm up on my toes, and I sink in, and you'll see my elbows start to bend as I sink in. And once I do that, I push in with the other hand, and then I get my tension with almost a lean, just like that, and the client goes ahead and moves, nice and slow, and when this is bad, it's bad. They're going to finish off that motion. You're going to hold it at the end for a count of maybe 5 or 6 seconds. Now the key, I want you to see this. Come a little bit closer. I want you to see how my feet are. So the key here is a couple things. As we're sinking in, I'm getting my depth by going here, but my tension is actually a pivot with my feet. So I'm here, and I pivot like that. And as the client moves, go ahead, I'm going to kind of go around and go here, because the whole time you want to keep your sternum over top, because that's where you have your power.